What is secondary hypothermia? Have you ever wondered how an athlete can experience hypothermia even when they are not in freezing conditions? This brings us to the topic of secondary hypothermia. Secondary hypothermia happens when an underlying medical issue affects the body's ability to keep its core temperature stable. This can lead to a drop in body temperature below 35 degrees Celsius or 95 degrees Fahrenheit, even without being exposed to cold environments. Unlike primary hypothermia, which occurs from direct exposure to cold, secondary hypothermia is caused by other factors. These can include trauma, drug intoxication, endocrine disorders, infections, or metabolic problems. For athletes, this is particularly important to understand. Injuries sustained during sports can increase the risk of secondary hypothermia. When an athlete experiences trauma, factors like bleeding or shock can impair the body's ability to generate and retain heat. In sports settings, the use of cold intravenous fluids during treatment can also worsen the risk of developing secondary hypothermia. Additionally, prolonged exposure to cold weather during outdoor activities can further complicate the situation. Athletic trainers, physiotherapists, and sports medicine professionals play a vital role in identifying signs of hypothermia in athletes. They must be alert, especially when an athlete has suffered an injury or has other risk factors. Recognizing symptoms early is essential. If not addressed, secondary hypothermia can lead to serious complications. These may include decreased heart function and impaired oxygen delivery to tissues, which can increase the risk of further health issues. Preparation is key in sports careers. Athletic professionals should be familiar with emergency protocols and have quick access to warming techniques. This can make a significant difference in managing cases of hypothermia effectively. In summary, secondary hypothermia is a serious condition that can arise from internal medical issues or trauma. It poses a real concern in sports environments where injuries and cold exposure can happen simultaneously. Being prepared to identify and treat this condition is vital for the health and safety of athletes.